So here's the potential of getting the system back in regulation. This is a patient of mine, Melissa, and this is her. She wrote this. I had large operable, so she was being pushed for surgical intervention management. But let's say that she did get her cysts taken out. Did she correct the process that got the cyst there in the first place? She's still dealing with a hormonal imbalance somewhere. So 16 years she'd been dealing with that. When she met me, she was having an ultrasound every 6 months, all the doctors pushing to have surgery, suggesting that, fear, it's going to be cancer, so here's what we have to do. And she had done everything. She was natural-minded, as well as going through the medical system. She'd done nutrition, acupuncture, homeopathy, Chinese herbs, everything she could think of. No noticeable improvement over time. And she had been asking the doctors to regulate serotonin and balance hormones, and no one knew how to do that. No one was helping her do that, even though she intuitively knew that that's what she needed to do, was get in better balance. And serotonin is, although it's a brain kind of hormone, neurotransmitter, it does have a lot to do with balance. So she saw me in September 2006. We prescribed some natural supplements, including a high-dose B6, and this was all done based on lab testing and other types of testing. 4 months later, she had her routine ultrasound, January of 2007, to monitor the cysts, to manage the cysts. That's what medicine does. And the ultrasound couldn't find anything. It showed the ovaries were completely clear of cysts for the first time in 16 years. So that is the potential. Now, I didn't do anything to remove her cysts. Once regulated, her system went back into balance. Her function went back into balance. Whatever chemistry that was creating a cystic abnormal type tissue growth was no longer there, so the cysts don't exist. So here's your next step. If you're interested in creating this type of regulation and health for yourself, here's how we work. You fill out your paperwork, including a records request for labs. We're going to look at everything that you've done up to this point, the labs that you've had done, and we'll sit down, we'll do an initial exam, and we'll fill in the blanks on the labs. So if we go back a few slides and you see the things that we need to really regulate your system, we see what you've gotten done already, and we add everything. Now I'll tell you this, most everything that we need is probably never been done on you. So we'll probably have to do a lot or most of what I just mentioned. So we get the labs, I'll sit down with you and explain literally on a timeline, this is off, this is off, this is off, and this is where we need to, this is what we need to do, and this is how long it's going to take, and here's where we're going to retest, and here's where we would expect, and it's an approximation, but here's where we're going to expect that your system's going to be back in normal, and we're going to watch it right along. So on this timeline, however long it might be, we can expect conclusion, and we can expect improvement on that whole timeline as we start to regulate your system. It gets you right, it ends the struggle, you get your life back once and for all. And that's another big idea, concept in functional medicine, is that we treat you to an end. For example, if you have high blood pressure and you go in for blood pressure medications, when is your treatment over? It's not fixing the system, it's not regulating to get your blood pressure back to normal, so your treatment is never over. You take that for the rest of your life. In functional medicine, there is an end, and I think that's a huge benefit to approaching medicine this way. So here's our contact information. You may be on our website watching this or have gotten this in a DVD format. Either way, this is how you get a hold of us, how you get more information. If you have any questions, I'm happy to speak to you personally. I am very available and very ready to help you. I want to help you if you're interested. So look forward to hearing from you soon, and thank you for listening.